I'm Corey Hart here with Mentavi and ADHD Online. I'm joined by our Chief Medical Officer, Dr. Barry Herman. He just returned from presenting our validation study at the 10th World Congress on ADHD. What were the most important takeaways you shared in the poster presentation?
It was really important to us to validate our diagnostic assessment as an instrument that could be relied on to provide an accurate diagnosis for adult ADHD. And so we set out to do a clinical study to do just that. Basically, the findings of our study demonstrated that when compared to the current standard of care for diagnosing ADHD in adults, which is a clinical interview, that our online diagnostic assessment was just as accurate. In fact, it was probably a little better at diagnosing positive cases of ADHD, and it was a little more conservative at ruling out ADHD. The important bottom line is that this was a first of its kind study to really demonstrate that an online assessment is valid and reliable for diagnosing ADHD in adults. And we think this really moves the field forward now for both telehealth and for diagnosing ADHD in adults. And it really sets a benchmark now for being able to demonstrate the evidence behind what we do. While I was the first author on this poster, this was a true team effort. There were a lot of people at Mentavi that were involved in contributing to the study itself and to the success and outcome of it.
Were there any other trends or insights at the Congress that caught your attention, maybe that affirm Mentavi and ADHD Online's direction?
There's a real focus now on ADHD in adult women, and lots of factors and issues related to ADHD in women, including the impact of hormonal changes, differences in symptomatology over the course of the disorder, starting with childhood and into adulthood, and a significant amount of research now being done in this area, and a lot on coaching, on ADHD coaching and the impact that coaching can have on combining that as part of a comprehensive overall treatment plan.
What's really great about moments like this is that we are furthering the conversation around these types of things. How do you see the results changing this conversation with our partners, whether they're, say, providers, universities, employers?
Over the last couple of years, we had often received pushback or objections about our assessment because it wasn't validated, and really questioning its accuracy when compared to the standard of care for diagnosing ADHD. And now that we have the data to back it up, I think this really will increase our credibility and also the attractiveness of what we have to offer to numerous partners out there.
We don't do this research just for Mentavi. What excites you most about the impact this validation could have in a broader sense?
It really moves the field forward now for telehealth. People love telehealth. Providers love it. Patients love it. A recent Center for Disease Control and Prevention report showed that adults with ADHD utilize 46% of adults with ADHD were utilizing telehealth services. But nobody had ever done the research to show that telehealth could provide valid and reliable diagnosis. And we've done that now. And so I think it moves the field forward. It challenges the field to create the science to support what we do. I think it's a very exciting time. Telehealth provides an opportunity for people who wouldn't otherwise have the chance to have access to care. It's agnostic about geography and socioeconomic status and race and gender and all those other potentially discriminatory issues that can estrange people from the healthcare system. So I'm excited about the study in that I'm excited about telehealth in general. We have a workforce shortage now in mental health. There's significant unmet need. We're never going to be able to close the gap in terms of that workforce shortage without having technology like telehealth available to provide better access to treatment And we're, I think, currently leading the charge from the standpoint of what we're doing in terms of creating the evidence now to support the validity and reliability of what we offer.
Thank you again for your time. Thanks for the team for all the impact and hard work.